Good evening, my friends. It is truly a pleasure to see so many people here tonight. Whenever I walk into a room like this, filled with people who genuinely want to understand their bodies better, it gives me hope. Sighs. Because the truth is, most of the suffering we see in modern medicine doesn't come from a lack of advanced technology. It comes from a lack of understanding about how the human body actually works. My name is Dr. William. I've been practicing medicine for over 40 years. I've worked in hospitals, research labs, cardiac units, and metabolic clinics. I've stood beside operating tables with surgeons. I've watched hearts beating inside open chests. Curious. I've watched them struggle, and I've watched them recover in ways that still leave me in awe. But tonight I want to talk to you about something surprisingly simple, something you do every single night of your life, something that almost nobody thinks about, something that over decades can quietly strain one of the most important organs in your entire body, your sleeping position. Now, when people hear that, they usually laugh a little. They say, "Doctor, you can't be serious. My sleeping position? I'm asleep. How could that possibly affect my heart?" Let me tell you a story. About 8 years ago, a man named David came into my clinic. David was 56 years old, successful business owner, not overweight, didn't smoke, blood pressure only slightly elevated, cholesterol a little high, but nothing dramatic. And yet David was exhausted. He told me something that I've heard thousands of times in my career. "Doctor, I wake up tired every single morning." Now, many doctors would have stopped right there, ordered blood tests, maybe prescribed a sleep medication, maybe told him to reduce stress. But something about David bothered me. He also had mild heart enlargement, not severe, just enough to raise my curiosity. So I started asking questions. What time do you go to bed? Do you snore? Do you wake up during the night? And then I asked a question that most physicians never ask. How do you sleep? David looked at me and said, "What do you mean?" I said, "What position are you in most of the night?" He said something very casually. "Oh, I always sleep flat on my back." Now here is where things get interesting. I ordered a sleep study, and what we discovered changed the way I talk to patients about sleep forever. Because every single night, for years, David's sleeping position was placing mechanical strain on his cardiovascular system. Not a dramatic strain, not the kind that sends you to the emergency room, but the kind that repeats itself thousands of times a night, every night, for years, and slowly, quietly. His heart was paying the price. Tonight, I'm going to explain something that most people have never been told. Not by their cardiologist, not by their primary care doctor, not even by many sleep specialists. Tonight, you are going to understand how the position you sleep in can change blood flow, pressure on the heart, breathing mechanics, hormone balance, and even the way your nervous system regulates your cardiovascular health. And once you understand this, you will never look at sleep the same way again. Because the truth is this: the way you sleep tonight can either help your heart recover or quietly strain it until morning. And the most dangerous part? Most people are doing the wrong thing for 8 hours every night without realizing it. Now let's move into something that most doctors will never explain in detail. Let's talk about the problem. Because to understand why sleeping position matters, you first have to understand how the heart works during sleep. I want you to imagine your body as a city, not a small town, a massive city. Your heart is the central pumping station, the main water plant. Your blood vessels are the pipes. Your organs are the neighborhoods. Your brain is City Hall. And every second of your life, this pumping station is moving thousands of gallons of fluid through an enormous network of pipes. Now, during the day, this city is busy. You're moving, standing, walking, digesting food, thinking, working. Your nervous system is active. But at night, something very special happens. The city goes into maintenance mode. Blood pressure drops, heart rate slows, hormones shift, your body enters repair mode. Sleep is when the cardiovascular system is supposed to rest. This is when your heart gets its break. But here is the critical detail most people miss. Your body evolved for sleep in certain positions. Not randomly. For hundreds of thousands of years, human beings slept on the ground, on their sides, shifting positions naturally. Gravity interacts with blood flow, lung expansion, venous return, the drainage of lymphatic fluid. All of these systems are influenced by body position. Now imagine what happens if that position compresses certain structures, or restricts breathing, or increases pressure inside the chest cavity. Suddenly the heart has to work harder. And when that happens night after night after night, the heart never fully enters that restorative phase. Now let me pause here for a moment because this is critical. Your heart is not just a pump. It is a pressure-sensitive organ. Every time pressure changes in your chest, your heart responds. Every time breathing becomes restricted, your heart compensates. Every time blood flow shifts because of gravity, your heart adapts. So if you spend 8 hours in a position that slightly increases resistance, slightly alters breathing mechanics, slightly affects venous return, your heart must work harder the entire night. And most people never know. Now I want to go deeper into the science because this is where things become fascinating. Let's walk through what actually happens in the body when you fall asleep. In the first hour of sleep, your nervous system begins shifting from what we call sympathetic dominance to parasympathetic dominance. In simple language, that means your body moves from fight or flight mode into repair and recovery mode. Your heart rate drops, blood pressure falls, breathing becomes deeper and slower. Your vagus nerve becomes more active. Now, the vagus nerve is incredibly important. It is one of the primary regulators of heart rhythm. It tells the heart to slow down, relax, recover. But here's where body position becomes important. When you lie in certain positions, pressure inside the thoracic cavity, that is the chest, changes. And when pressure changes in the chest, the return of blood to the heart changes. Let me explain this with a simple analogy. Imagine the heart is a pump connected to 2 reservoirs. One reservoir sends blood out to the body. The other reservoir returns blood back to the heart. That returning blood is called venous return. Now, venous return depends on pressure differences. It also depends on gravity, and it depends on breathing mechanics. When you inhale, pressure inside the chest drops. That drop helps pull blood back into the heart. So breathing is actually helping circulation all night long. But if a sleeping position restricts the diaphragm or compresses the lungs, that breathing pump becomes weaker. Now suddenly, venous return changes. The heart must compensate. This may increase workload. Now let's talk about the position that surgeons and sleep specialists increasingly warn about. Sleeping flat on the back for long periods of time. Now before anyone panics, let me be clear. Back sleeping is not automatically dangerous, but for many people, especially those with certain risk factors, it can create a perfect storm. Because when you lie flat on your back, gravity pulls soft tissues of the throat backward. This can narrow the airway, and even a small airway narrowing can change breathing patterns. Now, what happens when breathing becomes slightly obstructed? Your oxygen levels dip, your brain senses the drop, and it sends a signal to wake you slightly, not enough to fully wake you, but enough to restore breathing. This is called a microarousal. Now here's the problem. Each microarousal activates the sympathetic nervous system. That means heart rate increases, blood pressure spikes, stress hormones release, and this can happen dozens, sometimes hundreds, of times per night. Many people call this sleep apnea, but here's something that most people don't realize. Even mild airway restriction without full apnea can still stress the cardiovascular system. So every time breathing becomes restricted, heart rate jumps, blood pressure jumps, adrenaline releases, and the heart is forced to respond. Now imagine this happening all night long. The heart never fully rests. And over years, this contributes to high blood pressure, arrhythmias, and even structural changes in the heart muscle. Let me say that again because I want it to land. Your heart may be working harder at night than during the day, simply because of how you sleep. Now, here comes the turning point in this story, because the body has an extraordinary built-in solution, one that humans use naturally for thousands of years: side sleeping. Now, when you sleep on your side, several powerful physiological changes occur. First, the airway opens more naturally. The tongue and soft tissues fall to the side rather than collapsing backward. Breathing becomes smoother. Oxygen levels stabilize. Second, the diaphragm can move more freely. This improves that breathing-driven pump that helps blood return to the heart. Third, and this is fascinating, lymphatic drainage from the brain improves. There is a system in the brain called the glymphatic system. Think of it as the brain's cleaning system. During deep sleep, it washes away metabolic waste from brain cells. Research has shown this process may work more efficiently in side sleeping positions. So not only does side sleeping help breathing and circulation, it may help the brain detoxify itself during sleep. Now, this is where people usually lean forward in their chairs, because the next question is obvious. Which side? Left side or right side? For heart health, many cardiologists recommend sleeping on the left side. Why? Because of the way the heart sits in the chest. When you lie on the left side, gravity slightly reduces pressure on major blood vessels returning to the heart. This may improve circulation efficiency. It can also reduce reflux, which indirectly benefits sleep quality and breathing. Now, I want to address some myths because there are many floating around. The first myth is this: I've always slept on my back and I'm fine. Maybe, but cardiovascular strain develops slowly. Just because something hasn't caused symptoms yet doesn't mean it isn't affecting long-term health. Second myth: your body position doesn't matter once you're asleep. This is physiologically backwards. Position changes breathing, pressure, and circulation constantly. The body absolutely responds to position. Third myth: if I snore but feel okay, it's harmless. Snoring is often a sign of airway turbulence, and airway turbulence means the cardiovascular system is working harder. Every time I hear someone say snoring is harmless, I take a breath, because I have seen too many patients develop hypertension and arrhythmias from untreated breathing disturbances during sleep. Now, let me tell you something from clinical experience. Over the last 20 years, I have watched hundreds of patients improve dramatically from something very simple: changing their sleep position, lower blood pressure, better sleep, reduced nighttime heart strain, improved energy. Sometimes the simplest interventions are the most powerful. Now, I want to give you a practical protocol you can start tonight. First, become aware of your sleeping position. Most people have no idea what position they spend the majority of the night in. Second, train side sleeping gradually. Use a pillow behind your back to prevent rolling onto your back. Third, support the neck properly. A good pillow keeps the airway aligned and open. Fourth, elevate the head slightly if you have reflux or breathing issues. Even a small incline can improve airway stability. And finally, pay attention to sleep quality. If you wake up tired, if you snore loudly, if you gasp during sleep, those are signals worth investigating. Now, I want to be responsible here. Some people should approach sleep position changes carefully. Pregnant women often benefit from left side sleeping, but they should always consult their physician. People with severe shoulder injuries may struggle with side sleeping. Patients with advanced heart failure sometimes require specialized sleeping angles. And individuals with diagnosed sleep apnea should work with a sleep specialist. This is not about replacing medical care. It's about understanding your body better. Now, before we finish tonight, I want to return to David, the patient I mentioned at the beginning. After we discovered his nighttime breathing disturbances, we worked on several simple changes: weight management, breathing support, and most importantly, side sleeping. 3 months later, he came back to my clinic. He looked different, more energy, better blood pressure. His sleep study improved dramatically, and he said something I will never forget. "Doctor, I had no idea the way I slept could change my life." And that's the lesson I want to leave you with tonight. Your body is not fragile. It is incredibly intelligent, but it responds to the conditions you give it. And sometimes the smallest nightly habits shape your health in the biggest ways. So tonight, when you go to bed, remember this: sleep is not just rest. It is one of the most powerful forms of cardiovascular therapy your body has. And the position you sleep in can either help your heart recover or quietly strain it until morning. Take care of your sleep, and your heart will take care of you. Thank you for being here tonight. And if you've ever noticed changes in your sleep position affecting how you feel in the morning, I'd love to hear about it.